Hello, this is Dr. Tom Reisler. I'm a plastic surgeon at Florida Center for Cosmetic Surgery. In today's video, we're going to be talking about neck lift, also known as lower face lift. The four things that I normally address with a neck lift are: one, saggy, lax skin. The other thing is fullness or puffiness under the chin, which we also call double chin. And the third thing that we can address is jowls, which usually occurs here. And the last thing is the banding of the platysma muscle in the neck. The ideal candidate can vary from any age, from 30 up to a later age. It depends on their anatomy and their appearance. And the surgery is normally tailored to the patient's needs and anatomy. The procedure is done under general anesthesia normally, where the patient comes in on the day of surgery and is discharged the same day. With the surgery, there's a combination of incision. Normally, it varies from just behind the ear to in front of the ear, depending if we need to adjust the jowls. In addition, there's normally an incision just under the chin, hidden within or just behind the natural crease that you have under your chin. The surgery involves tightening up the skin, the muscle, and also performing some liposuction if indicated to better define the angle of the jaw, the lower border of the jaw, and the excess fat that is deposited in the neck area. At the end of the surgery, I normally leave a single tube that spans from one side to the other underneath your skin. And that tends to stay in for about 3 to 4 days. It helps with the speed of recovery and reduces the problems that you can encounter, such as seroma or hematoma or fluid collection. And the sutures normally comes out after 7 days from the front of the ear if there's any incision in front of the ear, and the rest are removed within 2 weeks from the back of the ear. In terms of results, you will see results quite immediately after the surgery once the bandages is removed. But the final result normally takes anywhere between weeks and months afterwards once the edema or the swelling settles down. Neck lift by no means stops the process of aging, but it certainly can knock off some years in your appearance and can make you feel much more refreshed and younger and make you feel as young as you feel. In the next video, I'll be also discussing facelift, which sometimes is done in conjunction with neck lift. Neck lift is usually reserved to patients who have good upper 2/3 of the face in terms of volume and lax skin tone. So there's not a set ideal age group for this neck lift procedure. I've seen and treated patients with the age range from 30 up to 60 and 70. It all depends on the individual's anatomy and rate of aging. As I mentioned before, if someone has a excessive amount of lax skin, then they're a good candidate. If someone has a full neck with a double chin and lack of definition, then they're also a good candidate for the liposuction and tightening up of the skin if there's any redundant skin. Patient with very obvious animation and banding of their platysma that is bothersome, then they're also good candidates to have that treated with a combination of placation, i.e. tightening up the muscle from the front and the back, and also releasing it to give you a nice hammock-like appearance of a well-defined neck and chin. Some patients have a very weak chin, and in conjunction to the neck lift, I can also perform a chin implant that will give you a better harmony between your chin and your neck. And this is done through the same incision that I perform under your chin, just where the crease is. Another ideal candidates are patients with massive weight loss. They tend to have a lot of lax skin and lax muscle, and they usually see a dramatic improvement after such procedure, where I can remove the excess skin, tighten up the muscle, give them better jaw definition, and also eliminate some of the jowls depending where I put my surgical incision. Of note, if I solely make my incision behind the ear, then the jowls are less likely to be addressed, and that's where making the incision in front of the ear or performing a formal facelift can address the jowls. But I can reduce the jars by performing some liposuction as well if I restrict my incision to behind the ear only. Next, I'll be talking about the recovery of neck lift procedure. As I mentioned before, you go home same day after surgery with a tube which is secured to the back of your neck. You'll be bandaged up and sent home with painkillers, muscle relaxant, and antibiotics. Most patients find that they only need painkillers for a day or two and no more than that. And after that, they can switch from narcotics to simple Tylenol or non-steroidal like ibuprofen. I advise all my patients to have their head elevated after surgery, as that will help reduce the swelling or edema after surgery and will speed up your recovery time. In terms of the position of the neck, again, I recommend that patients keep their chin up and not flex it down, as that can cause wrinkling and creases under the chin. And so maintaining a proper posture and with head of bed elevated for at least 7 days to 10 days helps with the recovery. Next, I'll be seeing you the day after surgery to ensure everything's fine and to answer any of your questions. And following that, I'll probably see you 4 days later to remove the bandage and remove the drain. After removing the drain, after the 3rd or 4th day, I will reapply your compression dressing around your neck and see you a week often from the day of surgery. At that time, I will remove your sutures, which are placed either in front of the ear or just at the lower edge of your ear lobe. Then I'll see you a week after that to remove the rest of your sutures from the back of your ear. And in terms of results, you'll see immediate results once I remove your bandage after 4 days. Obviously, you'll be swollen and bruised, but that tends to improve in weeks and months later. In order to improve or reduce the bruising, I recommend eating fresh pineapple and papaya, as they have natural enzymes that can break down bruising. And also, some patients find it useful to use arnica tablets a week before surgery and continue it afterwards. You can also apply topical creams such as arnica to help with the bruising. If the bruising is very stubborn and is very slow to resolve, then we can also offer laser therapy which breaks down the bruising right away. Return to normal activity, I usually recommend to wait for at least 4 weeks, and that's how long it normally takes for the scar to heal and most of the edema or swelling to resolve. But prior to that, you are able to perform non-exertional exercises like walking, but no heavy lifting until 4 weeks after the surgery. So if you're interested in finding out more information about the procedure or to find out if you're an ideal candidate, feel free to reach out to us at our office. I'll be more than happy to speak to you and go over your goals and what I can achieve. If you find this video helpful and informative, don't forget to like and subscribe.